Well, good evening. Hello to everybody. And for those of you who are new here, usually we're on Sunday nights. So it's kind of weird here being on a Thursday. But it is Bell Let's Talk Day today. A perfect chance for us to talk about mental health, which is what the Happy Molecule does. And I really want to salute the people at Bell for starting this so many years ago. They started at a time when mental health was still not a thing to talk about out in the open. And I think they've done a very good job and probably helped it along for all of us to talk about it. This is a day to talk about mental health, not just for those who may live with depression or have a mental health issue of some sort. It's for everyone, because guess what? Everyone has mental health. And if your mental health has not been challenged over the last few months with this pandemic, I think you're a robot. It has been a very tough time. It's been a tough time. It's been a time that we really do need to talk. And I encourage you not just to talk on this day, today, when it says we talk. We need to talk all the time. And we're going to talk more about what you should be talking about, how you should be talking, what you should be saying, how you should be supporting, how you should be listening. That's the other important thing about today. I wonder if we need a Let's Listen Day as well, because listening is as important as talking. We have a special guest coming up in a few minutes from the Canadian Mental Health Association. But first, for my regular viewers, we usually start with a bit of a breathing exercise, because what it does is it teaches us to get into the moment, to relax, and to concentrate on this. We'll put all the worries and the anxieties off to the side for now, because if we are going to fix anything, if we are going to work on anything, we have to concentrate on it. So we're going to do that in a moment. It's called a box breathing exercise. Again, this is for the benefit of people who don't usually do it. In fact, if you are new here, please put up your name on the comments. Please put up your name in the comments. I want to know who our newbies are. But when you breathe in, you're going to breathe in through your nose, and you're going to smell fresh, cool air. And you're breathing in slowly for 4 seconds. Then you're going to hold it for 4 seconds. And then you're going to breathe out through your mouth. And as you breathe out through your mouth, you're going to try and take some of the stress and anxiety that's in your body, wherever you're feeling it. In your stomach, in your chest, in your arms, in your shoulders, in your neck, wherever you're feeling it, you're going to try and let a little bit of it go. And we're going to do this for about a minute. Ideally, you could do it for 2 or 3 minutes and 3 or 4 times a day. It's called box breathing. Breathing in through your nose, holding it. Breathing out through your mouth, holding it. The holds are important, to hold the breath. It's really important, because what you are doing is you are taking the reins of your parasympathetic nervous system, which thinks it's doing a good job on its own, but if you're stressed out, it's not. So you're taking the reins of your parasympathetic nervous system, and the indication for that is the holding of your breath, because what you're doing is you are stopping your sympathetic nervous system from taking over. So we want to gain control. Now, without further ado, we do have a little bit of help from our stress ball. Spunky the stress ball. Please welcome him. All right, Spunky, all set. Here we go, everybody. Breathe in through your nose for 4 seconds. Breathe in. Follow Spunky. Hold it. And this hold is very important. Now you're going to breathe out through your mouth. Take some of the stress and the anxiety. Let it go. And you're going to hold it. Don't strain. If it's too much, shorten it down. Stop doing it. It's okay. Just follow Spunky. So you're going to breathe out through your mouth. You're going to hold it. Don't forget to feel that cool, fresh air coming in. Breathe in. And just hold it gently. Just hold it gently. No strain. Now take some of the anxiety and let it out through your mouth. Keep going. All right, Spunky, thank you very much. We'll see you on Sunday.
Woohoo!
Spunky the stress ball. Gotta sell that. Gotta sell that. So today we're talking about Let's Talk, and let's bring an expert in right now from the Canadian Mental Health Association, CMHA. Rebecca Shields, the CEO for York Region and South Simcoe. Hi, how are you, Rebecca? Happy Let's Talk Day.
This is an incredible day. Hi, and hi to all of our listeners. This is amazing. I just want to thank everybody for being here and being part of this conversation. I'm just thrilled.
It is a really important day. And like I said, it's an important day for everyone. Whether or
Mhm.
not you have some sort of mental health issue or not, you still have mental health, or you may know someone who needs you to listen.
Absolutely. The best way that mental health was ever described to me, or our health in general, because it's all connected, mental health is health, is that we all have a mental health jar. And all of us, our jar gets filled up or things get taken out of our jar. And sometimes we have a genetic predisposition or something happens and little balls come into the jar. When that jar fills up, we go from good mental health into not coping and things start spilling out of the jar. And then today, when we start having conversations, these are the things that help us take those little balls out of the jar. And, you were talking earlier about the pandemic. It's like every day that pandemic has been like a little drop in that jar. And so having this conversation, talking to each other, learning how we can help each other, all of those things are going to help us keep our mental health jars, with lots of room in them so that we can have good resilience. So I'm so thrilled to be here.
I love that about a jar. In fact, you could physically almost do that as an exercise, is get a big jar and start writing your stresses and your anxieties and throw it in the jar. And you could write in your gratitudes about what you're grateful for and thankful for, throw it in another jar and try and even them out.
I think that is such a wonderful idea. And I think you just touched on, one of the most important things is, also putting it in the jar and letting it go. And also learning to live with gratitude and appreciation in the moment, because, in the moment, sometimes things are okay in the moment. Even though we can have all these worries, sometimes you can just sit down and go, I'm sitting in a chair and I'm okay at this moment. I'm safe. My kids are safe or my loved ones are safe. So at this moment, I'm okay. And so sometimes it just breaking it down into those moments by moments when things are so wild and information's coming and there's so many unknown factors, sometimes that really helps. And I think that idea of using a jar, or some people call it a worry jar or a gratitude box or whatever you use, all those are wonderful ideas.
Let's get right to it right now. Now, I have borrowed something from Bell's site, and it's called letstalk.bell.ca. By the way, is their
Yeah,
website. It's on the screen. CMHA.ca for the Canadian Mental Health Association's website. You have wonderful resources on there. But let's talk first of all about ending this stigma.
sure.
And to end the stigma, to begin with, language matters. How you say things, what you say, the words you use. Let's expand on that a little bit.
Yeah, thank you. We often use the word offhandedly, oh, she's so crazy, right? Or
Hmm.
that's crazy, or,
Or you're nuts.
or you're
Yeah.
nuts, and we say it as a joke. We don't realize that, those words kind of have hurtful meanings. Also, sometimes, somebody is legitimately upset and they go, oh, she's just anxious, and they dismiss legitimate concerns as being an illness rather than understanding that sometimes we have legitimate concerns, and that can delegitimize our own uh, our own real illnesses and our own real struggles by making them just an offhanded thing. And so it's on both sides. When we talk about mental illness, we're talking about illness and we're talking about health and we're talking about our overall health. And, as your listeners know, it's all connected. When we feel depressed, we can feel pain, but also our physical ailments can lead to stress. It's all interconnected, and we have to understand that mental health is health. And when we're struggling with mental health issues as physical health issues, it's exactly the same, that we need the care. And I think one of the Bell Let's Talk champions, Michael Landsberg, he always
Hmm.
said, sick, not weak. And
Hmm.
that we understand that when we make those comments like, oh, she's crazy, or or they're making really awful jokes about mental illness, or we see bad depictions in the media, or we relate this idea that somebody is just lazy rather than depressed and having real health struggles. When we do that, we take away and we isolate people, and we make them feel ashamed, and they feel that they can't reach out for help. And that's really the struggle, is that this is legitimate. We would never do that if somebody had broken their arm. We would never do that if somebody had cancer. One of the things I was sharing today with somebody, and I had a really good conversation. We never tell somebody who has cancer and then they have more cancer in their body and it's expanding, that we never call them a frequent flyer.
Mm-hmm.
And yet, in mental health issues, people who have to come back to the emerge because they're in crisis, we sometimes call them a frequent flyer, like an awful way to depict somebody who's going for legitimate healthcare needs.
I find as well, and when we are taken into a hospital emergency, and especially if at first they don't know what it is, and of course their first assumption is it has something to do with your heart, your respiratory system, and so automatically you go to the very top of the triage list.
Sure.
As soon as it's determined, wait a minute, this is a mental health issue, you go to the very bottom of the triage list. Your pain is still there. You're still suffering. Now, I think there need to be better places for us to go than a hospital emergency for this, but I mean, that's for a much larger conversation.
It's true, but it's all, it's all that's connected, right? It's all that connected about the very real health impacts and mental health impacts of having a mental illness, of struggling, and then not feeling like you can reach out or talk to somebody and get the support you need. And what we know is that mental illness is like any illness. It's like if you have a cold and you don't treat it, and all of a sudden you end up with bronchitis, and then you end up with pneumonia, and then it just escalates and it gets much harder to treat, and it takes more time. But if you had just gone and taken care of that cold, or you capture something early, then of course we can actually, the recovery rates are much better and much quicker. And the really important thing to share with all these listeners, with mood disorders like depression, most people with early intervention, we can have recovery rates of 80% in a year. Just think about that. Sometimes people wait and wait and wait. By the time they seek help, they're far along in their illness, and it takes much more, rather than if they just said, look, I'm not myself today, or my husband, my wife, my spouse, my child, my friend, my coworker, I really noticed that they're just not themselves. 3 years ago or a year ago or 6 months ago, they were doing great, and now they're not. Maybe I need to check in on that. And I think that's part of what we're talking about today, is how do we check in on that?
Rebecca, let me share something with you that works for me, and it is the talking. I don't have them nearly as much now because I've really learned to live with my depression. However, I still have anxiety attacks every once in a while. The best way that I find, once and with a panic attack, with an anxiety attack, it's almost impossible to stop once it's started.
Okay.
So what I do is I talk about it with someone. I tell them, I'm having an anxiety attack. You are? And I describe it to them. And do you know what? It takes away the sting considerably if I'm talking through it, because I'm talking.
Well, and at the very basic, we have to understand that humans are hardwired for connection. We need connection for our survival. What we know is from the research is that connection and belonging are exactly the same as water and food, thirst and hunger. We're hardwired. If you don't drink when you're thirsty, your body depletes. If you don't eat when you're hungry, you get malnourished, your body depletes. If you don't have connection, belonging, your body depletes. We know this. Loneliness and isolation, chronic loneliness, is equivalent to smoking 15 cigarettes a day. And in that micro moment of isolation, when we need somebody, that is a depleting. We need that as if we need a drink of water. And so when you say, I'm in crisis, my safety, my personal feeling of safety around anxiety or depression or isolation, by reaching out and having that connection, that feeds our body. That connection allows us to build resilience. It takes that little ball or that paper out of that jar to help us take that next step forward. So we need people around us. And yet, what we're talking about when we talk about stigma, the impact of stigma is often that we isolate people, that we exclude them. They lose their jobs, they can lose their loved ones because people don't understand or they feel ashamed, rather than just saying, hey, we need to wrap our arms around you because we can help you get better, because together, and only together as a community, strong, loving, caring communities, can we connect people. And in that way, through talking, through engagement, even just sitting beside somebody, and what you said at the very beginning, Kevin, so important, listening, just being there to listen, not solve it, just say, you know what, I'm okay to hear your story. Very important. And that's really how we get through this together. This, how we get through the pandemic together, as we've said, is, apart but not alone.
Okay, let's get back to our list. We're talking about ending the stigma.
Sure.
And this, of course, thanks to our friends at Bell. Let's talk. Educate yourself. So important. And
Yeah.
that helped me immensely. Whether or not it's you who has the mental health issue, depression, or whatever, or it's someone you know, there is so much available. And like I said, for example, cmha.ca, letstalk.bell.ca, lots of links there. What is mental health? What is depression? What is anxiety? What is chronic? What's not? What can I do? So educate yourself.
Sure. Great point. And you know what? You've already spoken to two really great resources, but there's tons of great resources. And one of the things that I always tell people is, use those credible resources. Make sure that you're not just going on random social media, because there is a lot of myths out there. And we want to make sure that we're driving people to credible resources and connecting them to really good providers like the Canadian Mental Health Association, or like any of our healthcare partners, whether it's, if you're in Toronto, it might be CAMH, or it might be one of our hospital partners. But make sure you are talking to your primary care doctor. They're there for you as well. In fact, they are often the first step for many people who are accessing services. So, if you feel like you need to talk to your doctor or reach out, there are so many phone lines and available. And of course, we welcome to have those conversations at CMHA.
And I know that Kids Help Phone, and God bless the people at Kids Help Phone. Oh
Yeah.
my gosh, have they stepped up this year. They now talk to adults, by the way. So don't let the name Kids Help Phone, it's a misnomer now. They do incredible job. There are many, many lines out there to educate yourself. All right, let's get back to our list and take a look at the next one, which is be kind. Now, I'm gonna sort of embellish this a bit, because I know what Belle was talking about was be kind. Don't be judgmental. Don't tell the person, oh, come on, just get over it, or anything, or all right, I'll listen. But you have to be kind. But you know what? When it comes to ending the stigma, you got to be kind to yourself. You got to say, you know what? I need some help. And that's okay.
That's a brilliant comment. And it's true. Kindness starts with ourselves. Gratitude starts with ourselves, and being in the moment. And that is so important. What we've seen in this pandemic is the stress, and how many people just feel that they have to, tough it out. And, I think of whether it's, people who are single and living alone and they're isolated. And I think, well, I shouldn't be doing this. And I shouldn't be feeling this difficult, or parents with young children at home that are struggling with online learning and trying to, work and be at home, or, people who, really feel that they have to go to work, or, our small business community that's really struggling. People are struggling, and they're feeling like they have to tough it out. And that can be really hard, and the strain, and they're not being kind to themselves. And so therefore they're not kind to other people. Right?
Yeah.
Because you can only we can only absorb, we have to discharge, right? So when we can be kind to ourselves, and maybe it's take a walk, talk to a friend, maybe it's have a bath, maybe it's have more of your wonderful breathing moments, whatever it is that works for you. If you can do it for yourself, then you can do it for somebody else. And just remind them that some people want to bake bread, and some people want to go and run a marathon, but whatever works for you, just take that moment to find out those things that will let you stay present and breathe, and just realize that, everything is going to be okay if you just take it one step at a time.
All right, let's round out that list now, if we could. Uh, the final two on there: listen and ask, and then once again, emphasizing talk about it. So again, we're talking about communication in both of these cases. So listen and ask. Don't tell and solve. Listen and ask.
Absolutely. And, we talked a little bit, when we first met, Kevin, you said, what does active listening look like? Like, how do we listen to somebody, especially, when we want to jump in and we want to say, oh, because we want to help, right? Like, let's just acknowledge all your listeners. I can see them. They're so kind. They want to be helpful. But sometimes the most important thing is just giving somebody a chance to just tell their story, or just sit quietly, or just say, you know what? I'm okay to be with you right now. But some of the great phrases that, we've all heard them a million times, that we can all remind ourselves is sometimes just the phrase, tell me more. Okay. I've had a hard day. Tell me more.
Yeah, exactly.
Like, not why did you have a bad day, or you should have had a bad day, or of course you had a bad day. It's just tell me more. Or, another great phrase can be, what is it about today that makes it different for you? So those open-ended questions. And I think inviting then somebody to kind of express themselves slowly, or on the other hand, if they just say, you know what, I don't really want to talk about this anymore, it's like, that's okay too. You know what? You don't have to tell me anymore right now, but when you do, I'm here.
Sorry, I didn't mean to cut you off there.
No, go ahead, please.
On my program, I've talked to several people about suicide. And folks, it's okay, by the way, to say that word, okay?
Yes.
It's okay to talk about suicide. In fact, it's vital to talk about it. But the one thing that without exception, because I ask each of them, I say, when you've talked to someone who wants to end their life, and you're there as they say, okay, no, I'm going to give it another chance. And I asked them, I said, what was it that changed your mind? I was hoping there would be what did they say that changed their mind? Almost without exception, they say, the person just looked at me and said, because they will ask them, say, well, how come you changed your mind? Because you listened. I talked to one gentleman, Kevin Briggs, who was a California Highway Patrol officer. Part of his area was a Golden Gate Bridge, which we know is a magnet, sadly, for those wanting to end their life. And he has done this hundreds of times. And he says, almost without exception, they come off from the side of the bridge and he says, why didn't you jump? And they said, because you listened.
Yeah. Let's take us just an extra second to just share with your listeners a couple of really important points. One, you're right. If you say to somebody, when I've heard that people feel really hopeless, or they feel like there's nothing left, when you hear those really dark statements, and that's often really cues, I'm no good for anybody. I feel really hopeless. It's okay to say to them, do you feel, sometimes when I hear people say that, they're thinking of killing themselves, and it's very direct, or they're thinking of suicide. Are you thinking about suicide? And then they say, they might say yes, or they might say no. The really important point then is go, oh God, no, don't feel that way, and then you start to panic, right? So you have to, if you're going to ask a question, you sort of have to be prepared to say, if they say, yeah, I am, it's like, okay, the next question is, let's get you some help. And if you've not been trained in suicide intervention, crisis intervention, wherever you are, you call that distress line or the suicide intervention line, and get that person on the phone with somebody who can talk to them. Because if you panic, and you shut them down, they might feel like they've hurt you, and it might exacerbate. So it's important to ask, it's important to be open, and know that there are 24/7 phone numbers. And you can just say, you know what? This happens all the time. I understand. Let's call somebody. Let's call 911. Let's call somebody. It's so important to reach out, not to turn away, but to gently pass on to somebody who is available. Now, I've been trained, and everybody at our branch of the Canadian Mental Health Association, and many do, are all trained in suicide intervention. So I've been trained, it's, over years, every year I get trained in suicide intervention so that I feel comfortable having, and I've had those very difficult conversations. And always I think to myself, I've got to get this person into care. If this is serious, I want to get them the support that they need, but I never turn away. And that's what I want to encourage listeners. It's okay to ask. Asking about suicide doesn't make somebody want to do it.
No.
You're right, absolutely, Kevin. It's actually a prevention, and it's a very effective way for us to all save lives.
Hey, some great news as well. A couple of weeks ago, the House of Commons passed a bill saying that they are going to go ahead and institute. Oh, Parker, do you remember the number? Was it 988? Or you would know, Rebecca. There's a suicide number similar to 911.
Right.
But I'm not sure when it's going to be put in, but it is coming. So that's a recognition right there, the importance of it.
Yeah, absolutely. This is saving lives. I mean, globally, I understand the stat is one person every 40 seconds loses their lives to suicide. And that is a tragedy. It is a preventable. And we need to be talking about this. And there's lots of parts. We need early intervention. We need strategies. We need crisis intervention when it happens. There's so much that we need to do. But I'm very glad that there is now a national strategy being developed. And Canadian Mental Health and all of our mental health and addiction partners and the hospitals were all involved in this really important work in order to save lives. And there's a wonderful campaign on about just, giving people another day, more time to heal, because with the right treatments and support, people can heal. And that is the important message, and that people can go on to have wonderful recovery and meaningful lives. But, that place of hopelessness is real, and it is real, and we have to take it as seriously as we do any other healthcare issue.
Talking with Rebecca Shields, CEO, CMHA for York Region and South Simcoe. And let's move on now to another set of graphics from Bell Let's Talk. And this is about taking care of yourself.
Right.
So taking care of yourself, take breaks. So this is so important, my friends. Take breaks from news and social media. Do you know why? It's nothing but bad news. And then and doesn't social media get you angry? And don't you repost angry things? I'm not saying get rid of the news completely. Watch it 5 minutes a day. That's all you need. But to constantly be reminded of the pandemic, constantly be reminded of isolation and loneliness doesn't do anybody any good.
Right. It's, everybody's unique. And I always say that everybody has to find their own balance. But you're so right. One of the things is if we get into obsessing, then you're not in balance. If you find yourself getting stuck, how can you get unstuck? And those are those, really important tools, like cognitive behavior therapy is one that we really use for this. And what's wonderful is that there is a program called Bounce Back, and Bell supports Bounce Back across Canada. And of course, here in Ontario, for your listeners in Ontario, it's free. And it's cognitive behavior therapy that's delivered over the phone, and it's effective and it works. And in Ontario, it's funded by the Ministry of Health. But these are really important tools. And the thing is that, we're not always taught about how to get out of that cycle when we're thinking, and we worry more. And so that idea of taking a break, and I saw some other great things on the list. So how would you take a break? Talking to someone, and I keep bringing up talking because it's Bell Let's Talk Day, but it's not just that. It can be going for a walk. It can be doing a meditation. It can be doing some exercise and focusing in on that, and whatever it is that brings you joy. And having those things right at the ready is really important, so that, if you're in that moment, that you have something that you can hold on to.
We, according to a study, I think it was Cornell, there was one study that had said that out of the thousands of thoughts, and some people had tens of thousands of thoughts a day, that 80% of what we think about every day, 80% is negative. And a lot of that has to do with our social media and with constantly seeing the news. We're worried about everything. And most of that stuff never happens about what we're worried about.
Well, my grandma, bless her heart, she had this expression. She used to say, Rebecca, worrying's like being in a rocking chair. You can spend a lot of energy and not get anywhere. And I've always thought about that. You know, look, we're human. And that's the other part of this, is that back to that kindness, is we're human and we're going to think about stuff and we're going to worry about it. So, but what can you do? You can journal. Those are really great ways. You talked about writing stuff down. Write it down, put it aside, say, okay, and then say, well, right now I'm okay. I'm going to deal with this. And chunking it down, and all of those great CBT skills, and whichever way that you can get it. Some people have access to it through work, through their employee assistance plans, or seeing a counselor. And again, there are services that you can, and as I've mentioned, bounce back before, and you can self-refer into the bounce back program, or your GP can refer you. But there are other services that are free, that are available in every province in Canada and territory, has some form of therapy to really support people, so that you can learn these valuable skills, because it really is skills that we need to learn, just like we need to learn how to cook, just like we need to learn any new sport that we play or musical instrument. This isn't stuff that you're supposed to know. We have to learn how to do this stuff sometimes. And many of us didn't get it when we were kids. So now we get to learn it as adults, and we can teach our kids as well.
Well, this is it, right? This is such an essential thing. Mental health is the worst healthcare crisis facing the world today. Mental health leads to almost every other problem we have. You have heart disease, you have heart problems or heart issues. It's most likely because of mental health, because you didn't learn how to take care of your stress and take care of yourself and be kind to yourself. Sickness, a cold, can be traced back to mental health, because your immune system goes down when your mental health goes down. Your immunity shuts down because it's working so hard, because it gets into that fight or flight, that whole fight or flight situation, that it's taking everything, including your immune system, and it's putting all the energy towards your anxieties. So we have so many things, but we've never learned to deal with them. So, back in the early 1900s, if you lived in a town or a city, it burnt down about 2 or 3 times every decade or so. Fires would start and it would spread like crazy. So what did we do about that? Did we just build more fire halls so that we'd have more firefighters to respond? No. We started learning prevention. We started learning, getting fire retardant materials. We started making better houses. We have smoke alarms now, and we send firefighters to school, to kindergarten, to teach the kids how not to play with matches. So that's what we need to do with mental health. We need to start with kids, and we need to start young, and we need to say, how are you feeling? And what can you do about that?
I love it. I love what you're saying, because it really comes down to understanding that mental health is health. And we take care of our physical health needs, and we take care of our mental health needs. We know we need to eat right. We know we need to exercise, and we know we need good, some people call it mental hygiene or mental health or whatever you want to call it, but it is all of those things. And, because we're breaking down the stigma, we also know that sometimes we just have illness, and it happens. And major mental illness can happen. We know that 1.6% of the population, no matter where you are in the world, is impacted by schizophrenia. It doesn't matter whether you're in North America, Europe, or Africa, it's the same. So we're learning more about genetic links and why these illnesses take place, but sometimes you can do everything right, and you can eat right, and you can exercise, and you can still be impacted by a mental illness. And that's because we're humans, and our humanness and our biology and biopsychosocial environmental conditions can impact us, and we have to understand. And that's why we need good health care, and we need good mental health care, so that when we get sick, that there's treatment. And that treatment can be both through medicine and seeing a doctor, and it can be through great therapy programs and seeing a psychologist or CBT or therapist or peer support groups, whatever that is. But we need both. And And we need to know then how we promote good mental health and good resilience, because we're always going to be faced with challenges. And so we need those skills, and whether it's CBT, meditation, mindfulness, there's lots of different things that people use, and whatever is right for you, I support, because different people need and experience the world in a different way. And I'm really open to a lot of different practices. And what we see is around the world, there's lots of different ways that people practice good mental health. And it can be doing calligraphy, it can be doing different social activities, Tai Chi, whatever it is that works, all those practices are good, and we need to continue to learn and find what's right for us.
Let's get
At
back
a good sleep, at a good sleep.
A good and healthy sleep. I mean, it's all the main pillars, right? It's a good and healthy sleep, it's a good diet, it's exercising, and it's positivity. If you could use all of those, your mental health would be fully supported.
I believe, one of my favorite people who speaks on this is Dr. Ian Dodd. He's over at Trillium. I think he's a chief of psychiatry over there now. And he always said, we treat, he's a psychiatrist. He goes, we treat mental illness, but mental health is a home, a job, a friend. And I've thought a lot about that in the work that we do. It's having a safe and affordable place to live. Nobody is going to be well if they're homeless or they're at risk of homelessness, or they're unsafe in their home. And people need to work. They need to have purpose, and they need to have economic stability. And and we talked about this before, but they need belonging and social networks and people that they love and take care of them and their family. And chronic loneliness, again, I brought it up before, is a major public health issue. And we need to ensure that everybody is connected. And so talking and in these wonderful conversations of this wonderful community that I'm watching chat and talk, that's all part of us being connected. Oh my gosh,
aren't these viewers great? They're having their own show over here. They're not even paying attention to you and me, Rebecca. They're having I'm watching their conversations. They're chatting with each other. But that's
I love it. I'm like, I will be back.
Let's go back to our list, if we could. You were talking about loneliness there as well. We were talking about the UK has a minister of loneliness. Yeah. I'm not kidding. That shows you how important it is.
It is the number one reason why a senior will end up and stay in hospital, is that they are lonely. They're chronically lonely, and that those drive, where they can't get out of hospital and because there's nobody home for them. So seniors really impacted by loneliness, but they're not the only ones. Newcomers and refugees that come into different communities, all of us might experience episodic loneliness, but if you know somebody who've ever experienced chronic loneliness, you know how challenging that is. And that is a major, major precursor to depression, and it is a huge risk factor for suicide. So I think a lot about loneliness and how we can, draw attention to it as a public health issue, and just the way that the Ministry of Loneliness in the UK, but they're not the only ones. In fact, Vivek Murphy, who was the former under
Surgeon
Obama
General,
administration, he was really talking a lot about loneliness and trying to end it as a public health issue. So I think we have to have a lot more conversations about that as part of Bell Let's Talk Day.
I'm concerned because this is the only evidence I have is anecdotal about what I'm about to talk about. I've talked to a number of people who work in long-term care facilities, and we already know that COVID has taken just a horrible toll on our LTCs. But at the same time, I'm hearing that the number of deaths in long-term care facilities, as far as they're concerned, and again, I don't have the numbers for this, is on the rise. Not COVID, but everything else. But the problem is that loneliness does not get put on a death certificate, so we don't know. So heart disease will take someone, their organs shutting down, anything caused by the loneliness. But the loneliness doesn't get put onto the death certificates. We don't have a true sense of what toll it's really taken. So we've taken our seniors. Some of them get no visitors, and some of them get visitors, not all that often for all that long, maybe one day a week if they're lucky. Now we've taken all that away, and we've taken any outings away, and we've taken any entertainment away. And so we've asked them to sit in that home by themselves they're lonely around a whole bunch of other lonely people. And God bless those who are taking care of them, our caregivers and our nurses and our doctors and our staff in these facilities.
It is, we're really beginning to talk, and I think the pandemic has been a catalyst for conversations around social isolation and loneliness. And I'm really hopeful that although chronic loneliness was a public health issue before the pandemic, it shone a spotlight on it. And when you talk about the impact of the pandemic on the isolation of seniors, or even the isolation of single people that are stuck in apartments, that are young, they're really struggling with the social isolation. Our teenagers are really struggling not being with their friends, as many of us are. The number of times I hear from my friends and through my work about the people who just want to hug their mothers, or fathers, these are real challenges for people. And what you're getting at is what I was talking about earlier, is that hardwired need for belonging. Not having it does, through the cortisol, through the way our body responds to it, it does deplete. It depletes our immune system. It depletes our overall health, and it can be experienced in different people, but it absolutely takes its toll. And as I said earlier, it's equivalent to smoking 15 cigarettes a day, chronic loneliness. And we know how bad smoking is. So I hope that we begin to more and more draw attention to this and look at this as a long-term way that we want to get together to create strong communities of belonging.
All right. I saw a comment go by, and I don't want to let it go without mentioning it. This is part, one of the risks that I run in doing a live show and being open, is that I get someone who does talk about their depression being so severe, saying things like they can't deal with another day. And we had a comment like that come up. So I don't want to go through the whole comment, but I want to send a message to that person, and they know who they are. I'm hoping you're looking for help, that you've gotten help. CMHA, right there. If you go to the CMHA website, there's going to be a red bar on the top, okay? And it's going to give you instructions what to do when you feel that way. It's as easy as that. You may feel alone. So to that person, please promise me, can you send me a note that you have reached out and you've done something? It would make me feel a little bit better. Let's get back to our list if we could, Rebecca. Unless Rebecca, actually, Rebecca, you're the expert. Can you say something to someone out there? Because she's not the only one who's feeling that way. Yeah. There are people who are feeling, I don't know if I can deal with another day. What
I've learned is that often when we need help the most, it becomes harder and harder to reach out, because mental illness is tricking our brains. And this is a thing that that it's so hard to understand, is why is our brains in illness and hopelessness saying, well, I just shouldn't reach out. And what I want to tell people is that's not real. That's the illness, and that we are here and everybody is here to help, and that there is hope, and that we can help you recover. And it doesn't have to take that long, and it doesn't have to be that hard if you reach out and get the right supports. And I know that there's going to be listeners there that talk about the challenges of navigating the healthcare system and other things, but know that there are caring, kind people. There are peers out there, people with lived experience, who are part of our teams that have been there to help you understand. There's some of the best people to connect with. And know that just start the journey. Give us more time to work with you and to connect with you, and know that it's going to be okay. People get better all the time. The recovery rates are much better than we report on. We often hear about all the bad stories, not all the people that get care and begin to, have wonderful, exciting, hopeful lives. And that doesn't mean that we don't, once you've been there, that we don't struggle with illness again, because all of us who've been through it know that it doesn't end every day. But that's life. But the thing is you can have a life of meaning and wonder and health and recovery. Just reach out. We're here. It'll help. Please reach out. Please, we'll talk.
let's get back to our list and taking care of yourself, taking care of
Yeah.
your body and mind. We talked about that. We talked about sleeping and eating properly. I, I know that can be tough, but you know what? Sometimes you have to discipline yourself. Connecting with others, of course, very very important. Push yourself to do it if you have to. When's the last time? Like, go through your phone list, your contacts, and start calling people one by one if you have to. This is important. This next one. Maintain as normal a routine as possible. I got to the point, Rebecca, that I was not taking a shower every day.
Right.
But before the pandemic, I did without fail every single day, and I showered and I shaved and I had something to eat as soon as I got up. I got out of that habit for a little bit. I felt terrible. So now it's like keeping that routine sometimes can be difficult, but it's important.
Yeah, absolutely. And I think you've hit on some really key ones, and we should go about that. So, how do you start your day? Getting up, and if you can, shower every morning, that's great. But making your bed, one thing to, just make your bed, get it clean. We often talk about those simple little things. Having a healthy breakfast, really important. And I think sleep is the key.
Mm-hmm.
Right. I really believe that often when we're not sleeping well and our sleep gets out of whack, everything else just starts to spiral around that. So that idea of how do we come down and have good sleep? So we put our phones away an hour before bed. We don't put our phones in our rooms, right? We put them in another room and away from us, and we turn off those notifications. Um, maybe read a book, have a bath before bed, maybe if you're too tired in the morning, and again, have quiet music. I'm a big proponent of mindfulness and meditation, and guess what? There's lots of wonderful free
Oh
apps out
yeah.
there where you can, do some meditation and some mindfulness to just, bring focus. It's a great tool and technique. So whatever those things are that help you have a good sleep is really, really important. So maybe it's cutting out the caffeine right before bed. It's all of those things. So, and I think that there's lots of techniques that are going to work for you. But the basics that I always say are making sure that you get outside at least for a little bit of fresh air every day, making sure that you have healthy food, and making sure that that phone is put away, on that screen time is put away at least an hour or two before bed. And that's particularly important for parents that have youths out there. We know that those blue screens stop the development of melatonin, which can get in the way of sleeping. And so we want to make sure that we take away our blue screen so that we can have really good sleep, and we can have that melatonin that helps us have that deep sleep. Because without sleep, just everything gets just worse and worse and worse.
Yeah, it's your body's chance to rebuild,
Yeah,
to recreate.
yeah.
Let's finish out that list and go to the last one. When that one is focus your energies on what you can control. I cannot tell you how important this is. We get stressed out and anxious. So we all watched what happened at the Capitol on January the 6th,
Right.
and we get anxious and stressed
Sure.
out. And why did this and why did that? But you have to ask yourself, can I have any control over that? I can't? Okay. Then okay, I know what happened. I'm not going to let it hurt me personally. So if you can't control it, get rid of it from your anxiety.
You know, for all your listeners who don't know, often, and I think this is something that we can all learn from the Alcoholics Anonymous community, that they always had the first step in that community is always, I have no control over alcohol. But what they really begin from there is to go, I have no control over people, places, or things. I only have control over myself. And we often think about what we have control and not control over. And when we talk about doing CBT and all those things, we also think about, what do I have control over? I don't have control over the whole world, but I have control over, how I can respond and react. And we often make assumptions. Oh, that person's doing this, and we react. And what we do have control of is our behavior and how we think about things. And so, coming back to where I started, you're right. We don't have control over everything, and so we have to remember that it's normal to respond. It's normal that be upset by world events and the pandemic. But again, what do I have control over today? Today I'm sitting in the chair. Today I can turn off the news for a little bit, like you talked earlier. What can I control? What can I chunk down? And can I start with gratitude? I know a lot of people talk about a gratitude journal as a really great technique, and just, being in that place of appreciation and what things that are going right, and thinking about the good things rather than thinking about, all the things that are beyond your control. And so, we don't have control and of many, many things, but we have control over ourselves. And what we talked about earlier around, what are those good habits that I can develop? But there's many good habits that we can develop, and everybody has to figure out their own, and it doesn't have to be a whole big lot of things, but we can just set a goal that, my goal is, that I'm going to try to get at least 7 hours of sleep a night, and I'm going to work towards that goal. Or my goal is, I'm going to make sure that I try to have a little walk every day. Whatever that goal is for you, you've got to find your own thing. But really, really important that self-care is critical, and also reaching out to other people. And so if it's okay with you, Kevin, I'd love to share one little nugget with your listeners.
Please, yes.
That I learned. And, and I was really surprised by this, but they often talk about what was one thing that made people feel better. And you know what it was? It was helping other people.
Mm-hmm.
It wasn't asking for help for themselves. It was realizing that they could help other people, and that in giving, it made them feel much better. And so one of the things that we really encourage at our branch is how people can actually, help and support each other. So, whether it's you're helping your neighbor and you're saying, you know what, my neighbor needs help shoveling their snow, maybe I can do that. And in helping other people and connecting, that often makes you feel really good about yourself. So sometimes if you're feeling down, maybe the kindest thing you can do for yourself is actually not ask for anything for yourself, but maybe ask if there's something that you can do for a friend, and realize that if you can reach out to them and connect to them, maybe it'll help you as well. Because really that's how it works. So what we know is that by being generous, it often gives us a sense of a boost. Our own altruism gives us a boost. So I really want to encourage our listeners to reach out if they need help, and know that we're there, but also to reach out to other people and know that not only will they appreciate it, but it'll also help you feel better.
Well, by now, a lot of people are very aware of what Mr. Rogers' mother said to him. She had said, in times of trouble, always look towards the helpers. It'll make you feel better. And it's so true. And we have, there's a lot of organizations out there and groups that need help. Now, it could be someone who serves one person, could be someone who serves 100 people. I know that that some of these crisis lines are begging for volunteers to come in and get trained. And you are trained. You're not just put on a crisis line. All right. So if you're worried about, oh my gosh, I don't know how I could talk to someone who's in distress, they teach you, and you're never alone either. You're always able to reach out to someone. So that's a good way. There are many community organizations that need more help than ever right now.
Oh, absolutely.
Meals on Wheels and things like that.
I was just going to say that, it's very true right now. Food security and many organizations that are serving seniors and other people are really struggling getting to the grocery stores. And, is that a way that you can help? Mm-hmm. Can you do a friendly check-in call to a neighbor or a loved one and be that person to check in? So there's lots of ways, and, in your own local community to look up. I know that there's lots of ways that we're helping people, and we're doing a lot of food security. So you can check out links through the different CMHAs in your community. But it takes all of us together. I mean, the pandemic has shown us, if it's shown us one thing, is that we are all in this together, and that we all have to do our part in following the public health guidelines. And we also have to do our part in helping each other get through the public health guidelines, right? By reaching out and supporting people, and those neighbors who, may not be able to shovel their driveways, to go and give them a hand too.
All right. Rebecca, I want to thank you so much for this time. we've only just scratched the surface. We could talk about
Yeah.
this for hours and hours and hours because I think people need to talk. And I hope this is the start of something for many people. So Rebecca Shields, thank you so much for this.
Thank you. It's been a pleasure. And I want to thank all of your wonderful listeners again, their comments and just reading what they've been saying. What a brave and insightful and just generous and just a wonderful group of people. I think, Kevin, you've really created a community with your program, and it was such a pleasure to be on it. And
I didn't create this. They created it.
yeah, absolutely.
And they're my backup, though, because I
Yeah.
still, from time to time, need support, and I go to these people, and they're there, and they can even sense it in me. Say, hey, you having an off day today, Kev? So yes, they are wonderful, absolutely wonderful.
Absolutely. And I know that these are going to be the people that are going to be out there and sending that message of let's talk and mental health. And I just really want to thank them for, being the change makers and making our communities, better place. So thank you guys all for your time with me today. It's been just a real pleasure. And thanks again for the opportunity.
All right, Rebecca, have a great night. Thank you.
Thank you. Thank you.
All right. Rebecca Shields from the Canadian Mental Health Association. Fantastic hour of talking. And that's what this is all about, is talking. So not just a day, okay, folks? Not just a day. It's Bell Let's Talk Day. That doesn't mean that you have to confine it to today. I want you to talk. I want you to listen. I want you to reach out. Volunteer. The pandemic has been something that has been, none of us have ever experienced anything like this. The world has not experienced anything like this really since the Second World War, a time when we're apart from some loved ones, and we fear what's going to happen tomorrow, next week, next month, and we don't know. So it's been, 75 years or almost 100 years since we've had anything like this. And so we're uncertain and we're scared. And when we were kids, what happened when you were scared? You went to your mom, you went to your dad, and you were crying. And what did they do? And what did they say? They put their arms around you and they said, it's going to be okay. And it was. It was. That's what we need to keep telling ourselves and telling each other. It is going to be okay. It's a weird time. This is new for me too. But we will get through it together. It's going to be okay. But you can't do this on your own. Nor should you. So as soon as we go off the air, go through your contacts in your phone and start calling people or texting them or messaging them. My good friend Bryce Wild, who I interviewed, actually, it was the subject of my podcast this past week. He has some great ideas, by the way. Go listen to that podcast. He has some great mental health techniques. There's something called a contrast shower. Taking a contrast shower. It takes you 4 extra minutes in the shower, and it works. I've tried it. It works. Go listen to the podcast. But do you know what he did? Totally out of blue. A couple of weeks ago. I hadn't talked to him for a little bit. And he just... Let me see if I can find that message. Hold on. I'm going to share it with you because I think that was just... This is all it takes. Hold on. Where are you, Bryce? There we go. We've talked a lot since then. Where is that? Okay, there we go. Okay, so here it is. I don't know if you can sort of see that. He just out of the blue. Hey, how are you doing today, my friend? Okay, that's it. That was it. And I looked at it and I go, that's weird. So I answered him, and we talked back and forth. And after we did, I felt better. That's all it took. 1, 2, 3, 4, 5, 6, 7 words. How are you doing today, my friend? That's it. That's a conversation started. So keep the conversation going. Don't just make this Let's Talk Day. Let's talk, period. Let's Let's keep it going. It is going to be okay. It is. It's going to take some time. So thanks for joining me. I invite you to download my podcast. There's so many issues that I've dealt with that we've talked about tonight with Rebecca. Suicide, a good sleep. I talked to a sleep expert. Talked to motivational experts. I've talked to Bryce, who has the great tips for you this past week. So there's great advice and positivity there. There is a Facebook Live show that we do, and we get together every Sunday night, 7:00, and you can tell from the comments, if you're new here, you can tell that this group has been together for a while. So hope you can join us, and don't forget the website's right there; it's on your screen, cmha.ca and letstalk.bell.ca. There are great resources on there. If you don't know where to start, that's a great place to start. So cmha.ca. Letstalk.bell.ca. Silence is not an answer. Doing nothing is not an answer. If you're depressed, if you're anxious, if you're feeling that things are not worthwhile, you need to reach out, because you know what? You are important. You're essential. You're here for a reason. So don't take you away from us. Thank you so much for your time tonight. It was good. It was good. So thank you very much. Take care of yourself and take care of each other.